Thank you. And Leach's death is a reminder about the signs and symptoms of heart attacks. ABC 17's Ethan Hines shares tips he learned about how to prevent heart disease and what to do if someone's having a heart attack.
Heart disease could affect anybody, regardless of race, gender, or ethnicity. A heart attack occurs when blood traveling through the arteries becomes blocked, killing part of your heart muscle due to the lack of blood flow.
But the heart doesn't have nerve receptors like your skin does, so people feel it as like a pressure in their chest, and they get short of breath, maybe they'll get dizzy or lightheaded or sick to their stomach from that pain.
Plaque in your arteries builds up over the years, which creates those blocks in your arteries.
When a plaque becomes inflamed by tobacco or elevated blood pressure or elevated blood sugars and ruptures and occludes off flow, and then the part of the heart that's below that plaque and that blockage gets no blood supply.
Bostic says your heart could be damaged due to cholesterol, diabetes, high blood sugars, high blood pressure, and tobacco use, leading to potential cardiac arrest. Eric Hoy is the chief of Cole County EMS. According to him, if a family member or friend appears to be suffering from a heart attack, immediately call 911. Follow up by giving chest compressions.
Right on the center of the breastbone, right between in the middle of the chest, and compress hard and fast at a rate of 100 compressions per minute.
Your compression should be spaced like this. A good way to remember is to compress to the beat of Staying Alive by the Bee Gees.
It's more a disease of aging, so those over the age of 50 or 60 for men, but even as early as in our 30s, we need to start thinking about this.
MU Healthcare has started a program called Love Your Heart Screening. Anyone over the age of 30 with a risk factor is eligible for the program. Reporting from Columbia, Ethan Hines, ABC 17 News.
Now, Dr. Bostic, who we just heard from, encourages you to talk to your healthcare provider or contact MU Healthcare to see if you're eligible for the heart screening program. Today,